Feeling tired all the time? Struggling with brain fog, nerve pain, or muscle weakness that just won't go away? You might think it's just stress, getting older, or maybe even poor sleep. But what if the real reason is something much simpler and easier to fix? For many people with diabetes, chronic fatigue, nerve issues, and mental fog are actually signs of a deficiency in three essential vitamins: vitamin D, B12, and E. These vitamins are absolute powerhouses. They help fuel your energy, protect your brain, support your nerves, and boost your immune system. The problem? Most people, especially diabetics, aren't getting enough. But the good news is, it's totally fixable. And by the end of this video, you'll know exactly how to fix these deficiencies and take control of your diabetes. So don't forget to hit that subscribe button. 1. Vitamin D. Let's start with one of the most important, yet most overlooked, vitamins for diabetics. Vitamin D. Vitamin D isn't just about strong bones or getting a little sun. It plays a huge role in blood sugar control, nerve health, brain function, and even your heart. If you have diabetes, your risk of vitamin D deficiency is much higher than average. Why? Because insulin resistance, especially in type 2 diabetes, can interfere with how your body processes and uses this vitamin. And if you have kidney issues, something that often develops with diabetes, your kidneys may not be able to activate vitamin D properly, making things even worse. The symptoms of low vitamin D can sneak up on you. You might feel tired all the time, notice your wounds healing slowly, or struggle with mood swings. It can also contribute to diabetic neuropathy, that frustrating burning or tingling in your hands and feet. Low levels have also been linked to high blood pressure, poor immunity, and even stubborn weight gain. But vitamin D affects much more than just how you feel. It supports brain health and memory, and it plays a surprising role in fertility, in both men and women. So how can you get more of it? Sunlight is the best natural source, but let's face it, most people don't get enough. Foods like fatty fish, egg yolks, and fortified dairy help, but usually not enough to fix a deficiency. Supplements can help, but there's a catch. You also need vitamin K2. Vitamin D helps you absorb calcium, but without K2, that calcium can build up in your arteries instead of your bones. Magnesium is another key player. It helps your body activate vitamin D so you can actually use it. Unfortunately, certain habits can make your deficiency worse. Sugar, processed foods, alcohol, and even aging reduce your body's ability to produce and use vitamin D. So what's the ideal level? Most experts agree that for optimal health, you should aim for a blood level of 40 to 60 nanograms per milliliter. Optimizing your vitamin D could be a game changer. Studies show it can improve insulin sensitivity, reduce inflammation, and protect you from serious complications. It's not just about stronger bones. It's about stronger blood sugar control, better mood, less nerve pain, and a healthier future. N2. Vitamin B12. Your body's nerve protector and energy booster. This vitamin helps your body make red blood cells, keeps your nerves healthy, sharpens your brain, and protects your heart. If you have diabetes, you're at a much higher risk of B12 deficiency, especially if you're taking metformin. Metformin is one of the most commonly prescribed diabetes medications, but it interferes with B12 absorption. B12 deficiency often develops slowly and is easy to miss. Common symptoms include fatigue, dizziness, memory loss, brain fog, tingling in the hands and feet, and mood swings. It can also cause problems with sleep, like insomnia or restless legs. B12 is essential for nerve function. Without enough, the protective coating around your nerves breaks down. This can lead to nerve damage, pain, numbness, and even problems with balance or coordination. If you already have diabetic neuropathy, low B12 can make it worse. Your brain also needs B12 to produce neurotransmitters that affect mood, focus, and memory. Low B12 has been linked to anxiety, depression, and cognitive decline. In severe cases, it can even mimic dementia. B12 also plays a key role in fertility for both men and women. For women, low levels can lead to irregular cycles and pregnancy complications. In men, it affects sperm quality and hormone production. But here's the challenge. B12 is hard to absorb. Your stomach needs acid and a protein called intrinsic factor to absorb it properly. If you have gut issues like gastritis, Crohn's, or celiac disease, absorption becomes even harder. The best sources of B12 are animal-based foods like seafood, liver, eggs, and dairy. If you eat very little of these, or you're vegetarian or vegan, supplements are essential. There are 3 common forms of B12 supplements. Methylcobalamin is the natural, active form your body can use right away. Cyanocobalamin is synthetic and less effective. Hydroxycobalamin is a long-lasting version often used in injections for people with severe deficiencies. Other things can make deficiency worse, like alcohol, processed food, chronic stress, and poor gut health. And here's something most people don't know. Standard blood tests aren't always accurate. Serum B12 levels don't tell you how much your body is actually using. Ask your doctor for a methylmalonic acid MMA test or a homocysteine test instead. These are better indicators of true B12 function. The good news is that B12 deficiency is completely preventable and reversible. With the right diet and supplements, you can boost your energy, protect your nerves, and sharpen your brain. Take action now, and you may start feeling like yourself again. More alert, more focused, and more alive. Let's move on to 3. Vitamin E, a powerful antioxidant that quietly protects your body from the inside out. It fights oxidative stress, a type of cellular damage caused by high blood sugar that speeds up aging and disease. If you have diabetes, you burn through vitamin E faster because of chronic inflammation. When your vitamin E levels drop, your risk of complications goes up. That includes heart disease, nerve damage, fertility issues, and even vision problems. Early symptoms may include tingling, poor circulation, dry skin, memory issues, and coordination trouble. Vitamin E also supports your reproductive health and libido. It improves blood flow and helps balance hormones, 2 key factors for sexual health in both men and women. In men, it protects sperm from oxidative damage. In women, it may help with hormone-related issues like PCOS. Vitamin E is also essential for your eyes. It protects against diabetic retinopathy and macular degeneration, 2 common vision problems in people with diabetes. And when it comes to your brain, vitamin E helps protect against memory loss and cognitive decline. People with diabetes already face brain fog from blood sugar swings, so getting enough vitamin E is even more important. So where do you get it? Some of the best sources of vitamin E are wheat germ oil, almonds, hazelnuts, sunflower seeds, leafy greens, avocados, and olive oil. Natural whole foods are your best bet, especially when they're fresh and unprocessed. But if you're thinking about supplements, there are a few things you need to know. Look for natural vitamin E, listed as D-alpha tocopherol, not DL-alpha, which is synthetic and poorly absorbed. Even better, choose a supplement that includes a blend of tocopherols and tocotrienols. These forms work together to give you full antioxidant protection. Certain lifestyle factors can make a vitamin E deficiency worse. Processed food, trans fats, and gut issues like IBS, Crohn's, or leaky gut can block your body from absorbing fat-soluble vitamins like vitamin E. If you want to absorb more, you also need a healthy gut and a balanced diet that includes some good fats. The good news is that boosting your vitamin E levels doesn't have to be complicated. Start by adding more whole foods and cutting back on ultra-processed junk. Even small changes can help you feel better, think more clearly, and protect yourself from long-term complications. Vitamin E may not be flashy, but it works quietly in the background to protect your nerves, eyes, heart, and brain. And the best part, getting enough is completely within your control. Your body and your future self will thank you for it. If you've been feeling drained, dealing with nerve pain, or struggling to think clearly, it might not just be your blood sugar. It could be a lack of vitamin D, B12, or E. These 3 essential nutrients play a powerful role in how you feel, how you heal, and how well you manage your diabetes each day. The best part? These deficiencies are fixable. With the right food, targeted supplements, and a few smart lifestyle changes, you can start feeling better. You'll notice more energy, clearer thinking, and stronger protection from complications. Your health is in your hands. Small changes can lead to big improvements, starting today. If you found this video helpful, hit that like button and subscribe to Diabetes Healthcare for more science-backed tips. And don't forget to share this video with someone who needs it.